Good afternoon, everyone, and happy election day. Sorry, my background is a little dark. I am currently without power, but I'm going to try to get you this video before class ends today. So, I am Cole Dillman, and I am going to be discussing Hartnup disease. Now, everything I'm going to cover today is what Hartnup disease is, the history, the affected population and the prevalence, the signs and symptoms, the causes, case study with our hypothetical patient, diagnosis, treatment, and hopefully answer any questions you might have. Now, what is Hartnup disease? Well, it's also known as Hartnup disorder, and it's a genetic disorder caused by an inborn error of neutral amino acid metabolism. And just like many other conditions that we have talked about in this class, it follows an autosomal recessive pattern of inheritance. Now, what exactly causes Hartnup disease? Well, it's a gene mutation in chromosome 5 within section P at 15.33. You can see it at the very tip of chromosome 5 there to the right. Now, within this part of chromosome 5, there is a specific gene called SLC6A19, which provides the instructions for making a sodium-dependent transport protein called B0AT1. Now, B0AT1 is a primary transporter for neutral amino acids, in particular tryptophan. Now, B0AT1 is located in the apical plasma membrane in the cells lining the villi of the jejunum, the ileum, and within the proximal tubules of the kidney. Now, I don't want you to become overwhelmed. The main thing I was wanting to show you here is B0AT1, and I just wanted to show you that it goes in syn-port with one sodium molecule. So for every one sodium molecule, it is able to transport one neutral amino acid. Now, it is stimulated by collectrin in the kidneys and ACE2 within the intestines. Now, the discovery of Hartnup disease was in the 1950s in a family in England. They had several kids develop similar conditions such as ataxia, hand tremors, and rash. The doctor performed several tests, and it wasn't until he was analyzing their urine that he found the problem. There was an excessive amount of amino acids in the urine. In 1956, shortly after finding the disease within the Hartnup family, it was described in a journal. It wasn't until 2001 when Mizuki et al. Localized the gene responsible for the Hartnup disease to chromosome 5p1533. It was still unknown what exact gene was the problem. It wasn't until 2004 when two groups cloned the SLC6A19 gene from that section of chromosome 5 to find that it was in fact the disease-causing gene. What they also found was it wasn't just one mutation that could cause Hartnup disease. Up to 21 different mutations can cause Hartnup disease. And depending on which mutation you have, depends on exactly how much your neutral amino acid transport is hindered. Now, the affected population and the prevalence. There's not an exact number of people affected by Hartnup disease worldwide. It is very rare. Right now, it's estimated to be approximately 1 in 30,000. There were other studies that suspect that it's closer to 1 in 15,000 because they believe that it's highly over or underdiagnosed in the United States and other countries since we do have such a high intake of protein, which you'll later find out why that is. Now, Hartnup disease does not discriminate by sex. It affects both males and females equally. And the disorder generally gets diagnosed in childhood with symptoms starting in between the ages of 3 and 9. Now, what are the signs and symptoms of Hartnup disease? Well, some of the most notable ones are failure to thrive, photosensitivity, rash, diarrhea, short stature, headache, lack of energy, fainting, and multiple psychiatric problems such as like central nervous system abnormalities that can cause anxiety, sudden mood changes, depression, delusions, hallucinations, among many others. Now here I have created a list of the neutral amino acids within the body. Now, all of these in white are able to be synthesized within the body. However, the ones here in yellow are essential, which means our body is not able to produce them inside the body. Well, the primary concern here is tryptophan. It seems that the other neutral amino acids here in yellow are able to get into the body in adequate amounts, or at least amounts that don't cause any issues such as signs and symptoms. However, they suspect that tryptophan has a much lower affinity than the other ones here in yellow, which is what causes it to be so deficient, and is also why tryptophan causes almost every single sign and symptom that is seen in Hartnup disease. And some of the reasons this is because it's the precursor of serotonin and melatonin, which both affect the central nervous system. It's a precursor to niacin, which, if you've ever heard of pellagra, can lead to the 3 Ds known as diarrhea, dementia, and dermatitis, which are all symptoms that we see in Hartnup disease. And tryptophan is also involved in the production of NAD and NADP, which is heavily used in redox reactions, which we've learned recently in class is a major production of energy within the body, which can explain several other symptoms such as lack of energy and lack of being able to repair itself after physical activity. Now, here is the case study. His name is Leroy Jethro Gibbs. He's 9 years old. He's a male. His weight is 52 pounds, which is little below the CDC growth standards, and his height is 4'2", which is also just slightly below the growth standards. The patient presented with skin rashes over all of his exposed skin. His mother states that his energy has decreased suddenly, almost overnight. And then she also mentioned several other symptoms that have recently started, such as lack of appetite, inability to focus, mood swings, irritability, and he seems to always want to sleep. Now, the doctor went ahead and asked some more leading questions to find out more information and found that the patient used to spend all day watching his favorite TV show, NCIS. His mother was worried about his lack of activity and signed him up for school baseball team. Well, his practice just started a week prior to developing symptoms, and his practice involved long afternoons in direct sunlight. So his doctor went ahead and did a bunch of medical tests to see if he could figure out what was wrong. Well, his renal clearance test came back that he was expelling a lot of amino acids within the urine, which told the doctor that he was not able to properly absorb amino acids, and which is generally how all Hartnup disease is diagnosed, is within like a urine test. They can also do genetic testing to see if you do have one of the 21 genetic mutations that can cause Hartnup disease. The treatment for Leroy so he can have the best life is a lifelong high protein diet. Generally, a high protein diet can overcome the deficient transport of neutral amino acids in most cases, because people with Hartnup disease, the transporter is hindered, but they're still able to transport some. So I know whenever I first started investigating this, I thought it meant that none could get through, but in Hartnup disease, it's just lowered. So generally having a high protein diet can overcome the deficient neutral amino acids that our body needs, which is why I mentioned earlier that because here in the United States and in several other countries, we have such a high protein diet, it can often go undiagnosed. Well, nutrition within Hartnup disease is the key treatment because poor nutrition can exacerbate the negative symptoms. Where if you follow a proper diet full of healthy fruits, vegetables, whole grains, and foods recommended here that are high in niacin and tryptophan, you can pretty much live a life without problem. Now, other treatment recommendations for people with Hartnup disease are supplements such as niacin or vitamin B3 and a general multivitamin. They are encouraged to limit their sun exposure, but sometimes that's not always possible. So when they do go out in the sun, it is highly recommended that they wear pants or long sleeve clothing, anything that can cover up as much of the skin as possible. And then any exposed area of the body, they should always have sunscreen on. Medications, it just stated that they should limit their use because multiple medications can make our skin more photosensitive, which can cause the rash that you've seen in the previous pictures. Now, this is a little overboard. I just found it funny, and it was actually a picture saying that he was trying to protect himself from COVID. So, to summarize, to make this as clear as possible, because I know it's a lot to take in. So, it starts out with your mom and dad are both a carrier, and you end up in the 25%. You have a genetic mutation in chromosome 5 at section P1533. The affected gene, SLC619, which encodes for B0AT1. B0AT1 is a transport protein for neutral amino acids, which it has a hindered function. Because the hindered function, your body becomes deficient in certain amino acids. The primary amino acid that becomes deficient is tryptophan. Tryptophan is used to create serotonin, melatonin, niacin, NAD, and NADPH. Altered levels of serotonin and melatonin can cause central nervous system abnormalities and psychiatric problems. The lack of niacin causes skin rashes, diarrhea, and dermatitis, and dementia. Altered levels of NAD and NADP can hinder redox reactions, which can decrease energy, which can lead the body to not have enough energy to do functions properly. Generally, a high protein diet and supplements can overcome the amino acid transport deficiency and prevent niacin deficiency. And along with that, as long as the patients follow the recommended treatment, most people can live a normal, healthy life with little to no risk of early mortality. Now, here are all my references. And if I have any questions, hopefully I'll be able to phone in outside. We shall see. I'm going to run down and see if I can upload this at the local coffee shop. But regardless, make sure you vote if you haven't already. And yes, I did.